The Health Standards and Quality Bureau of the Healthcare Financing Administration is the federal agency that reviews the care you receive. Since your nursing home receives funding from Medicare or Medicaid, you have certain rights. Your nursing home should have provided you with this card, which lists the rights we are about to explain to you. We suggest you keep the card handy for future reference. To make certain that your rights are respected, a team of inspectors or surveyors visits your nursing home about once a year. They will ask to speak with some of you individually or as a group. These surveyors will be carefully listening to what you, your relatives, and the nursing home have to say about the quality of your life here in your nursing home.
I'm Sharon Smith from the State Health Department. I'm one of the surveyors here.
The federal government wants to make sure that while you live here, the nursing home protects and promotes all your rights. You have the right to be treated well and with respect. You have the right to be treated as an individual with your own needs and preferences honored.
Hi, Mr. Bond. I come in to see what time would you like to go to bed tonight?
I won't be ready till about 10 o'clock.
Okay, I'll be back in at 10 to get you.
Okay.
All right.
This means you can make decisions about yourself and have your wishes taken into account.
Here you go, Mrs. Brewer.
Oh, Mom, do I have to eat pork and all that? Please.
Oh, I'm sorry. Is there anything I can get you for a substitution?
I don't think so.
No. Would you like to speak to the dietitian?
Please.
Okay.
While your nursing home may not always be able to do exactly what you want, it has the responsibility to discuss your wishes with you.
Hi, Mrs. Brewer. How are you? Mr. Dean. I'm Adrian, the dietitian. I heard you did.
If you have a problem, facility staff must try to the maximum extent possible to find a satisfactory solution. You have the right to expect your nursing home to take care of your health needs.
We're going to slowly bring your leg out, and then you're going to bring it back in, just to the middle. And one thing, we want to make sure the toes are pointed up towards the ceiling. Bring it out. Just a little bit different.
You have the right to meet with other residents as a group.
Hello, everybody, and welcome to our resident council meeting.
Sometimes this group may be called a residence council. This group may discuss such things as individual concerns, acceptance of meals, and any changes they would like to see the nursing home make. When the surveyors visit, they will talk with groups of residents.
And I'm here as a state surveyor to do your annual survey.
You have the right to complain. If you have a problem that you and your nursing home are unable to settle, you or a family member can call your state survey agency to look into the complaint for you. Your nursing home has posted a list of other agencies you can call, such as your local ombudsman, who is available to help you resolve your problems with your nursing home. If you ever need the list, please ask one of your caregivers to provide you with a copy. You have the right for you and your family to take part in developing your care plan.
Do you have any questions in that
Most
area?
facilities have care planning meetings for each particular need, such as dietitian, social worker, and physical therapist.
I'm Lisa Mesmer, your physical therapist, from one service to another.
When your nursing home has such a meeting, you have a right to be present and participate in planning your care and scheduling your activities.
I've noticed that you've been in your room quite a bit.
This includes discussing your participation in activities that are meaningful to you,
always like to keep up with current events. And
or receiving the social services you require. If your facility does not have formal care planning meetings, you still have a right to participate in planning your care. All you have to do is tell a caregiver at the nursing home that you would like to help plan your care and activity schedule. You have the right to privacy whenever you feel you need or want it.
Ms. Hicks, can I come in?
This means privacy from staff,
Back in 15 minutes on this Boston.
I'll be back in 15 minutes.
or other residents, repair workers, and visitors.
Are you a person that likes privacy sometimes?
Yes.
You should also know that during a survey, surveyors have private interviews with some residents. If you are selected for a private interview, you have the right to agree or disagree with being interviewed. If you agree to an interview, you have a right to have that interview in complete privacy with no one else present. It is entirely up to you who is there.
Visit the nursing home to assure that all residents receive good care.
In addition to the rights we have talked about, you have many others, such as keeping and using your personal property in the way you like, maintaining your relationships with old friends in your family, making new friends, handling your money, and voting in local, state, and national elections. In other words, you have the right to continue living as an adult and a citizen.
N43.
The reason the Healthcare Financing Administration surveys nursing homes is to make sure that you are receiving good quality care and have the highest possible quality of life. Most nursing homes provide good care and a safe and comfortable life. Sometimes the surveyors find that the care given to you can and should be better. If so, our regulations provide several actions that must be taken to help your nursing home improve. Our ultimate goal is to have every nursing home provide excellent care and services. As every good health care provider knows, their most important job is to take care of you.